My name is Syona.
Yeah.
What's your name?
All right. My name is Dr. Abdullahi.
Okay. What's the patient's name?
Her name is Jamila Suleiman.
Nice to meet you.
All right. It's nice to meet you too. She
Um,
can see she's waving her hands to you.
hi.
All right.
Okay, can I ask you a couple of questions?
Go ahead.
Okay. Um, do you feel any fevers to the patient?
Yes, the patient. You want to ask the patient whether she has fever?
Yeah.
Yes, she has fever.
Okay, is it continuous? Does she continually feel that fever or is it on and off?
It's a it's a continuous fever.
Okay. Can you feel the patient's stomach to see if she's having any abdominal pain?
Yes. She's
Okay.
asking whether you have any abdominal pain. She said she doesn't have any.
Okay. Is a patient feeling weakness, headaches?
Yes, she has headache, but
Okay.
no weakness.
Okay. Is she coughing?
Yes, she has cough
Okay.
for 1 week.
Okay. So she has chest pain. She feels chest pain too.
Hello?
Yeah? Can you hear me?
Yes, I can hear you.
Okay. Um, can we get a chest x-ray and check the hemoglobin levels just to make sure just to check if she's anemia or not?
Okay. We have done a chest x-ray,
Okay.
and the chest x-ray is suggestive.
So she is having chest pain. There's
Yes.
okay. Um, so I'm gonna what's the hemoglobin levels?
We have done a hemoglobin. Our hemoglobin is 11.1 gram per deciliter.
Okay, so she doesn't have any anemia. So I'm gonna diagnose.
Yes.
Okay, I'm gonna diagnose the patient with ARIs. Um,
Okay.
my treatment would be antibiotics,
Okay.
and since this is in the future to prevent this from happening, get vaccines and just keep hygiene. Wash your hands.
Okay.
Okay.
It's all right. So you are going to give her antibiotics. You want to advise her on the need to wash her hands and good personal hygiene
Yeah.
so that she prevent further occurrence.
Mhm.
All right, that's good one.
Okay.
Um, uh, that will be communicated to the patient.
Mhm. Okay, thank
Yeah.
you.
Are you okay, or you still have something to ask?
I think that's all.
All right. So Fiona, that is interesting and that is really good. You started by asking whether patient had fever, and I told you the patient had fever, which is continuous.
Mhm.
You understand? It's good that you have asked what the patient complained, and the fever is continuous. You ask about cough,
Mhm.
which our patient had, and with history of fever and cough, you quickly go to the diagnosis of ARI.
Mhm.
You understand?
Yeah.
And you went ahead to request for you also want to rule out other things. You ask about abdominal pain or just abdominal pain. Yes, patient doesn't have abdominal pain, whether she has weakness, to try to rule out the possibility of anemia, which she doesn't have.
Yeah.
So you make a diagnosis of ARI.
Yeah.
I requested for chest x-ray, trying to look at that, which is suggestive.
Mhm.
um, you could have also requested for culture. You understand?
Yeah.
Culture could also help. Sometimes you could have a positive culture in patient with ARI. You
Uh-huh.
understand?
Yeah, yeah.
Yeah. So, and you have rightly treated her with antibiotics, which is very good. And
Thank
that
you.
is a treatment, especially for lower ARI. The ARI could offer or lower ARI,
Yeah.
which is mostly a bacterial infection that you
Mhm.
need to give antibiotics.
Yeah.
You also go ahead to talk about the need to prevent this. Do you
Mhm.
understand?
Yeah.
You can prevent it by giving the patient some of these advices, avoiding good personal hygiene and avoiding some of those things.
Mhm.
But you also know that sometimes you can also give preventive vaccines. Do you
Yeah.
understand where
Yeah.
I
Yeah, you can.
understand?
Mhm.
Yeah, right. It's nice meeting you today.
Nice
You
meeting
really
you
did
too.
well. That's